Thanks for your interest in learning more about the Viva-Mind clinical research trial. Viva-Mind is designed for people with mild cognitive impairment, or MCI, and mild Alzheimer's disease. It's taking place at academic medical centers and private clinics across the U.S. that specialize in MCI and early AD treatment, care, and research. In this video, Viva-Mind physicians and researchers will discuss the science behind the clinical trial drug varoglutamstat, describe who may be the best fit for Viva-Mind participation, and review what happens during the clinical trial.
These are unprecedented times to participate in Alzheimer's research. The time has never been better, the need has never been more acute, and the opportunity has never been more available to us than it is right now. We've come a remarkable distance in the past 20 years. Thinking back to where we were 20 years ago, the only way we could diagnose Alzheimer's disease was through post-mortem or autopsy tissue confirmation of the disease. Fast forward 20 years, we're now able to look inside the living brain of people and we can see the disease manifest, telling us that persons need treatment and they need it now. So in the Viva-Mind study, we will be investigating varoglutamstat. Varoglutamstat actually allows us to deal with a particularly toxic form of the protein amyloid, as well as the neuroinflammatory response it induces. So in fact, we have a dual mechanism of action.
We've known for many years that amyloid is an important factor in the development of Alzheimer's disease. In fact, it has to be there in order to make the diagnosis. We've been attacking amyloid in many ways. This particular drug is different. It doesn't actually remove the amyloid, it prevents its formation. So it acts much earlier than the drugs that we have currently. What hurts the cells the most in Alzheimer's disease isn't the accumulation of large amounts of amyloid. We believe that it's the smaller molecules that ultimately lead to the amyloid accumulating that are the most toxic. This particular medication actually prevents the formation of these smaller, what we call oligomers of amyloid. So these oligomers are felt to be more toxic than the actual plaques themselves. So although we are able to remove the plaques, if we don't also prevent the formation of the oligomers, we don't think that we're actually preventing the toxicity.
What is so exciting about varoglutamstat is that it addresses a protein that forms in the brain called pyroglutamated A-beta. This form of the amyloid protein only forms in people that have Alzheimer's disease. This may be the missing link in the amyloid hypothesis and our understanding of amyloid. So that's the first important point. The second is that we think that inflammation is a critical piece of the disease and occurs downstream to the formation of this toxic form of amyloid. Through this single treatment, varoglutamstat, we address both mechanisms directly with the hope that we can turn both faulty mechanisms off to benefit brain function.
Viva-Mind is looking for participants who are 50 to 89 years old, who have a diagnosis of mild cognitive impairment, also known as MCI, or probable mild Alzheimer's disease. These are individuals who are living in the community as opposed to a skilled nursing facility and who are already on an FDA-approved Alzheimer's disease medication for at least 4 months before they get screened to check for their eligibility for the trial. Diversity in clinical research is important for a lot of reasons. One reason is that we need to close the gap in disease disparities, especially for Alzheimer's disease. Certain groups are at increased risk for Alzheimer's disease, and we've learned from research that Alzheimer's disease doesn't look the same between different groups. We know that there are a variety of ways people are impacted by Alzheimer's disease, and so the more people that we can get in the trial from diverse backgrounds, the better information we can get about the disease.
People participate in the Viva-Mind clinical research trial for up to 20 months. Participants go through a screening process to determine eligibility. The screening process includes memory and thinking tests, a physical examination, heart rhythm and electrical brain activity tests, brain imaging using MRI, and blood and spinal fluid tests. These tests will be repeated at different points in the Viva-Mind trial. Half of Viva-Mind study participants are given the study drug, and half are given an inactive pill called a placebo to be taken twice a day.
So decisions to join clinical trials like this are not to be taken lightly. They're very well suited for people that want to be active against a disease that they feel is going to have a very negative consequence in their life. We have set Viva-Mind up for persons in the very early stages of this disease with the hope that we can actually help reduce the pathology and the downstream consequences of the disease at a time when it's still amenable to treatment. One of the strengths of this trial is in our recruiting network of sites across the country. We have very experienced sites, we have very experienced principal investigators, and teams that really have worked together, understand their commitments, and are prepared to work with participants closely. All in all, it speaks to a very strong scientific basis for this trial. We are really excited to see this trial launch and to be successfully conducted. We hope that this will be the treatment that succeeds. We hope this will be the one.
To learn more about Viva-Mind participation and find a site near you, please visit www.viva-mind.org or call 844-234-7500 to speak with a pre-screening representative.